I'm Dr. Anthony Galzarano. I'm here at my office with Chiropractic, which is located in the Roxborough section of Philadelphia. I'm going to speak to you briefly about herniated discs. Let's look at a model. This happens to be in the lumbar spine or the lower back. That's where most people come in to my office with herniated discs. The second most frequent area is the neck, usually the lower neck or the middle neck. Now the problems that are caused by herniated discs is pain right in the area, say in the lower back or in the neck, and if it pinches one of the nerves, then it can go all the way down, make your hand numb, weak, or your foot, and sometimes people have problems walking. In extreme cases, a person needs surgery. But I found through chiropractic, we can certainly improve the function in the spine and help to relieve the pressure, get the pressure off the nerve, and have the person go back to work or go back to their daily activities. So let me just show you what it looks like in the body. Here's a lumbar vertebra, here's another one, and right between them is the disc. It creates a pad and a pivot point for movement of the spine. This happens in the front, which is really about halfway between your back, where you feel those little bumps in your back, and your belly in the front. Of course, it depends how big your belly is, but it's basically in the center of your body. So here we have the vertebrae. Now what you don't see is the whole spine, and you have a bundle of nerves that comes right down the central canal. And as it goes through the vertebrae, past the vertebrae, it branches out into these spinal nerves. And these spinal nerves, in the case of the lumbar spine, go to your organs, to your sex organs, your digestive organs. They also branches go down your leg into your foot. So you can have a lot of problems from a herniated disc. What happens is you have crisscross fibers in the spine, in the disc, in the spinal discs. So they crisscross and they hold in a central structure called the nucleus. The nucleus is sort of hard gelatin, and it's located right at the center of the discs. So you have these crisscross fibers and they hold it in. Over time they can weaken, or if you're in an accident, it can happen suddenly, they can tear. And what happens, what it looks like in your body is a big sort of a blister that pushes back through the fibers. Now it doesn't come all the way out, it sort of makes a bulge, and the bulge fills the space where the nerve comes out and puts pressure on it. And that's why you have these problems. The problem down your leg, all the pain that people have associated with a disc problem. If you have a disc problem, usually the doctor will send you for an MRI. Anytime in my office I have a person with tingling or pain down the arm or down the leg, I don't wait. Insurance companies, sometimes they have this rule of 30 days. I don't wait 30 days because you need to find out what it is right away. So if there is pressure, if you've been in an accident and there's pressure on the nerve causing numbness or tingling, we get an MRI. If it comes back, I read my own MRIs in my office, but we also get a report from a radiologist. And if it shows that there's a herniated disc and you've been in an accident, most likely that herniation came from the accident. Sometimes what happens if a case goes to court, an attorney, a defense attorney will claim that the herniation was there, that it's part of the aging process, the wear and tear, especially in an older person. But that cannot be. You cannot have a herniation from degenerative change. You can see it, arthritis. What happens to the disc is it bulges out evenly, sort of like a ring ding. If you push it down, you'll see it squeezed. You'll see the cream inside squeezed all the way around it. That is a bulge. Now, a bulge can happen from trauma, but a herniation can never happen from degeneration. So that's what happens with a herniated disc, and that's what happens with a disc in trauma. You never have a herniation from degeneration. And I'll speak to you further on another video. Thank you.